Hello students, welcome. Hello students, welcome everybody. As your preparation is going on, 2 months to go for the Neet PG entrance examination. So we will be solving the MCQs. So let us begin with the MCQs from the different subjects. So every day we should keep a target of solving at least 100 to 150 MCQs. That will be helpful for you when you give the final examination. So those who are solving more, it's better for them, but solving it in a better way. So what are the different options and everything? So let us begin with it. The first question. A lady developed chickenpox during pregnancy. The highest risk of transmission to fetus is at which period of gestation? What do you think is the correct answer? First read the question carefully, then think about the answer, then look at the options. If you look at the options first, you will get confused. So what the mind knows, the mind sees. So let us see the options. A. 8 to 12 weeks, B. 14 to 18 weeks, C. 34 to 37 weeks, and D. 28 to 32 weeks. So what do you think is the correct option here? A. 8 to 12 weeks, B. 14 to 18 weeks, C. 34 to 37 weeks, D. 28 to 32 weeks. Let me give you a small information. This congenital varicella syndrome occurs in 0.4%, less than 0.4% of infants born to women who have varicella during pregnancy by before 13 weeks. So before 13 weeks, it is 0.4%. Now from 13 to 20 weeks, it is 2%. And after 20 weeks, it's almost negligible after 20 weeks. So here, the correct option seems to be 13 to 20 weeks. That is 2%. Before 13 weeks, it is only 0.4%. So here the option 13 to 20 is not there, but the option 14 to 18 weeks is there. So the correct option is, let us look what is the correct option. So the correct option is B, that is 14 to 18 weeks. So this chickenpox is a very important topic. You must know everything about the chickenpox, right from the chickenpox vaccine to everything. You must know about the chickenpox. It is a very high yield topic. Now let us move to the next question. A patient presented with the extension of MCP joint and flexion of IP joint. Which muscle is affected? So this is related to hand. Remember, the hand and foot both are important from the PG entrance or next pattern examination. So in anatomy, mostly they ask about the hand or wrist or the leg and the foot. So here a patient presented with extension of MCP joint and flexion of IP joint, interphalangeal joint. MCP means metacarpophalangeal joint and flexion of interphalangeal joint. Which muscle is affected? So what do you think is the correct answer? You can type in the chat. What do you think is the correct answer? So let us look at the options. Interosseous and lumbricals, extensor digitorum, abductor pollicis longus, abductor pollicis brevis. So what do you think is the correct answer here? See the extension of MCP joint and flexion of IP joint is due to the extension of MCP joint, metacarpophalangeal joint, and the flexion of interphalangeal joint is due to the paralysis of lumbricals and interossei muscle. So the correct option here seems to be lumbrical and interossei. So let us look what is the correct answer. The correct answer is A, that is interossei and lumbricals. Now let us move to the next question. Ligation of common hepatic artery will impair blood supply in. Remember, ligation of common hepatic artery will impair blood supply in. Remember that the blood supply of the stomach, the blood supply of liver are the very important high yield topics, and the stomach is a very important organ on which several questions are asked in the PG entrance examination. So I want to go forward to the options. A, right gastric and left gastric artery. B, right gastric and right gastroepiploic artery. Right gastroepiploic and short gastric vessels, right gastric and short gastric vessels. So the ligation of common hepatic artery will impair blood supply in. So what do you think is the correct option among these four? Can anybody type the answer in the chat box? See, the right gastric artery is a small artery which arises from the common hepatic artery. Again, right gastroepiploic artery originates from the gastroduodenal artery behind the first part of duodenum. And this right gastroepiploic artery, which is a branch of gastroduodenal artery, also arises from the common hepatic artery. So the correct option here seems to be B, right gastric artery and right gastroepiploic artery. So let us look what is the correct answer. The correct answer is B. So ligation of common hepatic artery will impair blood supply in right gastric and right gastroepiploic artery. Now this is a very important question. Why? Several times this has been asked in the previous entrance examinations, including the INICT. So drugs acting on via the tyrosine kinase receptor is A, TRH, B, TSH, C, insulin, and D, MSH. So what do you think is the correct answer? So it is TRH or TSH or insulin or MSH. So receptors for TRH and TSH are GS subtype of GPCR. GPCR means G protein coupled receptor. Again, MSH is also a GPCR. It is also a subtype of GPCR. So what remains is insulin. So tyrosine kinase receptor, the other examples are insulin, IGF-1, insulin like growth factor 1, and various other growth factors like PDGF, platelet derived growth factor, VEGF, vascular endothelial growth factor, EGF, epithelial growth factor. So the correct option here appears to be C, that is insulin. So let us look what is the correct answer. So the correct answer here is insulin, that is C. So let's move on to the next question. if the percentage of thymine residues in DNA is 28%. What is the percentage of cytosine? See, you have to remember the Chargaff's rule. What is the Chargaff's rule? A plus T plus G plus C is equal to 100%. In DNA, A is equal to T, G is equal to C. So the amount of A is equal to T and amount of G is equal to C. So this formula can be written as 2T plus 2C is equal to 100%. Now they have given T, that is thymine, as 28%. So you can write it as 2 into 28 plus 2C, that is equal to 100%. So 2C is equal to 44%. So C is equal to 22%. So the answer must be 22%. So let us look into the options. A 28%, B 44%, C 36% and D 22%. So the correct option seems to be 22%. How? I have told you about the Chargaff's rule. A plus T plus G plus C is equal to 100%. Since A is equal to T, G is equal to C, we can write it as the formula as 2T plus 2C is equal to 100%. So 2 into 28 plus 2C is equal to 100%. So 2C is equal to 100 minus 56, that is equal to 44%. 2C is equal to 44%. So C is equal to 20%. So the correct option is D, that is 22%. So let us look what is the correct option. So the correct answer is D, 22%. A patient complains of knee pain. Routine investigations are unremarkable and still the patient is unsatisfied. His urine turns black on standing. Now urine turns black on standing. What thing comes into your mind? Urine turns black on standing. Anybody? Urine turns black on standing in alkaptonuria. Correct, absolutely correct. Alkaptonuria. So, what happens in alkaptonuria? What are the clinical findings in alkaptonuria? There is urine turns black or urine darkens on standing. Then arthritis, pigmentation of the sclera and ear. Everything becomes dark. Pigmentation of the sclera, pigmentation of the heart valves, pigmentation of larynx, pigmentation of tympanic membrane, pigmentation of skin, darkening of the concha, anthelix and helix. Concha, anthelix, helix are the parts of ear. So all of them become dark. So there will be urine darks on standing, arthritis is there, pigmentation of sclera and ears, and there is pigmentation of heart valve, larynx and tympanic membrane. So this is all what. Let us look into the options. A. Homogentisate oxidase, B. Xanthine oxidase, C. Phenylalanine hydroxylase and D. Dihydroorotate dehydrogenase. Now let us look at phenylalanine hydroxylase. What happens in phenylalanine hydroxylase? What is the characteristic of urine? Mousy odor of urine. Mousy odor of urine. And the clinical segments in there is a nervous system is involved. So mental retardation is there, seizures are there, hyperactivity is there, tremor is there, and hypopigmentation is there. Hypopigmentation is there. Now coming to xanthine oxidase. Xanthine oxidase is involved in conversion of purine bases to uric acid. Uric acid. So the option here appears to be homogentisate oxidase. Let us look at the option answer. It is homogentisate oxidase. This question seems to be very easy. It can be changed, reformed, morphed. The options may be changed, but it will definitely come in the examination and you should mark it correct because your concept is clear. So you will be able to mark it correct. So let us move to the next question. A female is on maize as staple diet. Whenever maize comes into your mind, immediately you should know the options, correct options. They have given the history of diarrhea and a lesion in the neck region is found. It is due to deficiency of Mage staple date. Mage staple date. What do you think can be the options? So, mage eaters have niacin deficiency. Most commonly it occurs in mage eaters. And niacin deficiency also occurs in Hartnup disease and carcinoid syndrome. In carcinoid syndrome also there will be deficiency of niacin. So what happens in niacin deficiency? There will be 4 D's will be there. Chronic diarrhea, dermatitis, depigmentation and death. Chronic diarrhea, dermatitis, depigmentation and death. So let us look into the options. A. Zinc, B. Niacin, C. Thiamine, D. Riboflavin. Now what happens in thiamine deficiency? Thiamine deficiency results in either wet beriberi or dry beriberi. And riboflavin deficiency leads to ariboflavinosis, which is characterized by glossitis. The tongue becomes red. There will be corneal opacity. Dermatitis will be there. Dermatitis will be there. Again, in this also dermatitis will be there. So the correct option here appears to be niacin, because they have given mage as a staple diet and diarrhea is also given. So let us look what is the correct option. The correct option here is B. So female on mage staple diet, history of diarrhea, lesion in neck region. It is due to deficiency of niacin. So the correct option is B. Now graft used from an identical twin is called. Now let us see the various definitions. Before looking into the options, we should know the correct option. Autograft. What is autograft? Can anybody tell what is autograft? Type in the chat box. Autograft is a tissue transplanted from one site to another on the same person. Auto means self. From one site to another. Autograft. Now isograft. Isograft is the transplant from genetically identical donor, such as identical twin, judwa bhai ya bahan. Then homograft. What is homograft? It is a transplant from individual of the same species. When there is a same species is there, then it is called homograft. Then what is heterograft? Heterograft is a transplant from another species. Homograft means same species. Heterograft means another species. Autograft means same body from one part to another. And isograft means identical twin. Now let us look at the options. A. Homograft. B. Autograft. C. Isograft. D. Heterograft. So the correct option is identical twin means isograft. So the correct option, let's look. What is the correct option? The correct option is isograft. C. So graft used from an identical twin is called isograft. Effacement of food process is pathognomic of which disease? Now this word effacement of food process, do you remember anything about effacement of food processes? If you have read thoroughly, then this will not be a difficult question to answer. Effacement of food processes. Effacement of food processes. Effacement of food processes. So what do you think will be the options? Let us look at the options. A. Membranous glomerulonephritis. B. Minimal change disease. C. IgA nephropathy. And D. Diabetic nephropathy. What happens? What is the minimal change disease? What happens? The histopathology is normal, but in electron microscopy it will show loss or effacement of podocyte food processes. Loss or effacement of podocyte food processes. In membranous glomerulonephritis, you will see spike and dome appearance with subepithelial deposits. In membranous glomerulopathies, you will see spike and dome appearance with subepithelial deposits. And in IgA nephropathy, what happens in IgA nephropathy or Burgess disease? It is characterized with IgA means prominent IgA deposits will be there. Where it will be? It will be in the mesangial region. Mesangial region. Then in diabetic nephropathy, you will see diffuse mesangial sclerosis and nodular glomerulosclerosis and membranous thickening. So the correct option here is most probably B, that is minimal change disease. So let's look what is the correct option. Anti-glaucoma drug that acts by increasing uveoscleral outflow via ciliary muscles. Now whenever anti-glaucoma drugs comes into your mind, what will be the options? What will the most repeated options? Every time they ask this in the examination. It will be something like pilocarpine, dorzolamide, the brother of acetazolamide, latanoprast, timolol. So increasing uveoscleral outflow via ciliary muscle. Those who know the correct answers, type even before looking at the options. Okay, let us see the options. A. Latanoprast, B. Timolol, C. Pilocarpine, and D. Dorzolamide. Now let us look from down upward one by one. Dorzolamide is a carbonic anhydrase inhibitor. What it does, it decreases the aqueous production. So in glaucoma, you have to decrease the aqueous production or you have to increase the uveoscleral outflow. What happens in glaucoma? Fluid has accumulated, so pressure will rise. So if you decrease the fluid, then it will be helpful in treatment. So dorzolamide, it decreases the aqueous production. Now timolol. Timolol is a beta blocker. It also decreases the aqueous production. Now what about pilocarpine? Pilocarpine is a miotic agent that increases the trabecular outflow. Pilocarpine is a miotic agent that increases the trabecular outflow. Now latanoprost. What happens with the latanoprost? Latanoprost is a prostaglandin F2 alpha analog. PGF2 alpha analog. Prostaglandin F2 alpha analog that increases the uveoscleral outflow by increasing permeability of ciliary muscle. So the correct option appears here to be latanoprost. So let us look what is the correct option. The correct option is A, latanoprost.